Thank you very much. I'm delighted to be here. And I thought today I would talk about vaccines, in part because GAVI is one of the sponsors, UNICEF is one of the sponsors of this important symposium. And I understand many in this room are not primarily involved in the healthcare sector. So why do I talk about vaccines? Because I believe vaccines represent the finest example of partnerships between the private sector and the public sector. And the impact of vaccines is incalculable. A simple vaccine, smallpox vaccine, eradicated one of the worst illnesses from the world. Polio. I know polio was a big problem in Japan. When I was growing up, my next door neighbor became crippled with polio. That disease is almost eradicated today. And the vaccine that is accountable for this eradication costs about 15 yen per dose. So this is a remarkable, cost-effective solution to deal with healthcare problems. Now, the history of vaccines is very old. The first vaccines were made in the 19th century. Smallpox, rabies, tetanus. In the 1920s and 30s, new vaccines for diphtheria, pertussis, yellow fever, tuberculosis, and rabies were developed. In the 1940s and 50s, the famous Salk polio vaccine, and later in the 60s, the Sabin polio vaccine were developed. These were largely public sector initiatives, and these vaccines were made in the public sector. There were companies that manufactured these products, but they were not the originators of these vaccines. A big change occurred in the 1960s, and there was one man who was accountable for this change, a person named Maurice Hilleman. He was a military officer in the U.S. Army who was very interested in vaccines. And when he retired from the Army, he joined Merck, Sharp & Dohme, a pharmaceutical company in Philadelphia. And it was through his efforts that some of the world's most important vaccines were initiated. Measles, mumps, hepatitis A, hepatitis B, and the pneumococcal polysaccharide vaccine. This marked the beginning of what I would call the public-private partnership. Much of this intellectual property was developed in the U.S. military and in the public health service. And then Merck, a pharmaceutical company, for profit, developed these vaccines. At that time, the vaccines were sold at a very low price. They were broadly distributed. The biggest problem that occurred is that in the United States, there is this whole issue of medical liability. Vaccines are never perfect. There are very few but predictable side effects of the vaccines. And some of those side effects resulted in death. Because the lawsuits became so large, many vaccine companies who were in the business began to leave the business. But this is where public policy can make a difference. And in the United States, there was a famous law passed. It was called the National Childhood Vaccine Injury Act of 1986. The government recognized that without companies making vaccines, then public health was suffering. So what they created was a mechanism, basically no-fault insurance, that guaranteed a certain amount of money, a fixed amount of money, to somebody whose child suffered from the bad effects of the vaccine. That transformed the industry. The industry became an investor once again. And this has led to a new golden age of vaccines with, of course, hepatitis A, hepatitis B, but also rotavirus, pneumococcal virus, and most recently and importantly, human papillomavirus vaccines that prevent cervical cancer. Vaccine companies have come forward to meet the challenge of public health with exciting innovation. And every new opportunity is met with considerable interest by the industry as a whole. But the issue was that while companies could make money, there were still many people who could not access these vaccines. And for this reason, the Bill and Melinda Gates Foundation has been the largest supporter of GAVI, which is an organization that provides vaccines to the poorest nations in the world, or provides money to support the purchase of vaccines by the poorest nations in the world. In this manner, the public interests have been greatly served by the pharmaceutical companies, some of which are very wealthy US companies or European companies that have significantly reduced the pricing of their vaccines. For example, in the most recent round of discussions, GlaxoSmithKline took the rotavirus vaccine, the lowest price that they offered for that vaccine, and reduced it by 67% in a new price to GAVI. This has permitted GAVI to support the purchase of this vaccine by many, many more nations. The nations of the world have come to support GAVI, and in the most recent round of funding, have provided the organization with sufficient funds so that they could expend upwards of $1 billion per year to support the purchase of vaccines by nations. One of the most important developments has been the development of the private sector in the vaccine business in the developing world countries. Indian manufacturers, Chinese manufacturers, Indonesian manufacturers, manufacturers whose core competency is low-cost vaccine. This has created a very exciting opportunity for the development of new vaccines at a very affordable cost. One of the greatest initiatives that I was lucky to be a part of when I was with the Gates Foundation was called the Meningitis A Vaccine Project. Now, in the central belt in this belt of nations in Central Africa, meningitis A was a terrible problem, killing hundreds of thousands of people. And those who survived, many had lifelong neurological problems. So the health ministers from these nations came to the WHO at the World Health Assembly and demanded that something be done about this problem. The WHO, not knowing quite what to do, turned to the NGO sector and asked for assistance. The Gates Foundation was only pleased to be able to support this effort. The US FDA and the NIH had intellectual property that they were able to provide to support this effort. PATH, the Partnership for Advanced Technologies in Health, an NGO, became the grantee of the Gates Foundation to create this vaccine. And a study was done, and it was determined that this vaccine could only be successful if it worked the first time, and it worked nearly for a lifetime, and that it would cost less than 60 yen per dose. And so they partnered with a private sector company, the Serum Institute of India, and the net result was a vaccine 9 years later. This vaccine, I was fortunate to be able to attend the inauguration of this vaccine in Ouagadougou in Burkina Faso, and I gave one of the first doses of this vaccine to a 7-year-old child. I was very scared because I hadn't ever given a vaccine to a child before. But the child had a smile on her face, and that smile made everything worthwhile because I knew that the vaccine was going to save many lives. Now I understand that 100 million doses of this vaccine have been given, saving countless thousands of lives. That is what a partnership in support of an enormous public health challenge can accomplish. Now, the environment is good. Big pharma companies are involved. There are many GAVI commitments, and GAVI is wealthy once again, thankfully. There are biotech communities, biotech countries creating new technologies for vaccines. There's growth in the industry in the developing world. We still have challenges. We still have needs. New companies still have to come into this space. At Takeda, one of the first initiatives that I supported was the initiative to create a global vaccine business at Takeda. Takeda always had a Japanese vaccine business, but the idea that this vaccine business could have impact on the rest of the world was a very compelling vision that led to the company's investment in this business. And just last week we announced the purchase of a company that will allow us to have a vaccine for norovirus, a cause of diarrhea that kills almost 250,000 children each year. We still have challenges, many challenges. Regulatory challenges, for example, when the FDA makes a decision that's helpful to the US market, it may sometimes be very damaging to the developing world market. Understanding the implications of a regulatory decision in a rich world market can have enormous implications. For example, the FDA decided there was a concern about contamination of the rotavirus vaccine last year with a porcine virus. This virus, this caused them to shut down the manufacture of vaccines by one company and then considered the shutdown of the manufacture of another company. It turned out that most East Germans, the Germans of East German origin, had antibodies to this vaccine because when they ate pork, they were eating this virus. So in point of fact, this virus was not harmful. And this decision to prevent the manufacture and distribution of rotavirus vaccine had the potential to result in a large number of deaths in the developing world. Industry must still do more than its fair share just by simply making vaccines. Indeed, I'm part of an initiative that hopefully will come to fruition in which industry will provide funding, Gates Foundation will provide funding, and the Japanese government will provide funding and will support the discovery and development of new medicines and vaccines for the developing world. Hopefully that will come to fruition in the very near future. Donor countries, rich countries, must continue to give to GAVI. And countries in the developing world must support policy that ensures that vaccines are taken up, distributed, and have impact for all of the children in their countries. Bill Gates once said, humanity's greatest advances are not in its discoveries, but in how those discoveries are applied to reduce inequity. I believe that to be true. As much as everybody has done in this world, still 8 million children die each year unnecessarily from preventable or treatable causes. Vaccines are the most cost-effective way to prevent those deaths. It requires partnership between public agencies, between private entities, between governments, between UN agencies, between all peoples of the world to ensure that vaccines are delivered to save children's lives. Thank you.